Hello everyone, how's it going? Today we're going to discuss what hypothyroidism is, and we're going to discuss how you could easily wind up ignoring some of the symptoms in the early stages. If that sounds interesting to you? Then keep watching. So what is hypothyroidism? Well, hypothyroidism is actually a condition you could have if your thyroid gland doesn't make enough thyroid hormone. So that means you have an underactive thyroid. Now, some people believe that if you have that, it's going to just cause you to gain weight. But actually, having the correct amount of thyroid hormones is essential for the function of every cell in the body. Now, there are four main thyroid disorders. Today, we're just going to discuss hypothyroidism because that is the most common one. In fact, 1 in every 300 people in the United States actually has this condition. At the end of the video, I was going to tell you the thing that I noticed that improved the most when I was diagnosed and started being treated for hypothyroidism. So what are the symptoms? It can be a little tricky because many of the symptoms can actually occur with people who have other diseases. And even many of the symptoms might be something you ignore because you think it's just something that happens to you as you get older. So some of those symptoms are tiredness, sensitivity to the cold, constipation, dry skin, weight gain, puffy face, hoarse voice, coarse hair and skin, muscle weakness, muscle aches, tenderness and stiffness. The menstrual cycle can actually be heavy or irregular. You could have thinning hair, slowed heart rate, depression, and memory problems. Now, the symptoms can begin suddenly, but most often they develop very slowly over a matter of some years. So it might be something we could easily overlook and not really think too much about. The good news is that you can find out for sure by having your doctor order a blood test. The treatment is usually very simple. The blood test can show really exactly the right dosage, help the doctor get you to the right dosage of thyroid hormone. Once that's all settled, you just take your prescription medication every day, and then you just have your TSH tested every year. Now, there are some cases where your physician, they will do a physical exam, and after that they may feel the need to do an ultrasound just to get a closer look at any thyroid nodules. So now we've discussed the symptoms and how the disease is diagnosed. Let's discuss those who are at most risk and some of the things that can cause it. Before we get into that discussion, though, I just would like to remind you to please like and subscribe if you're enjoying the video. I really appreciate that. Those at most risk are women, and especially those who are over 60, people with a family history, those with type 1 diabetes or rheumatoid arthritis. Of course, anyone who's had thyroid surgery in the past, those with an iodine deficiency. If you're pregnant or you've had a baby in the last 6 months, you could be at risk. That would be postpartum thyroiditis, which is actually quite rare, only affecting about 5% of women. Or if you have Turner syndrome, that's a genetic condition. You also could be at risk for having hypothyroidism. So what are some of the causes? The most common cause is an autoimmune disease like Hashimoto's disease. The immune system is actually supposed to protect the body from invading infections, but sometimes it can mistake the thyroid gland cells and their enzymes for invaders, and they can attack them. Another cause would be if you've had thyroid surgery, radiation therapy, or thyroiditis. Wow, some of these words are hard. One cause that I found interesting was certain medications that you may be taking could actually lead to hypothyroidism. One of them specifically that I found was mentioned was lithium, which is used to help with psychiatric disorders. So if you're taking a medication like that, definitely we would want to check with your doctor and ask what the effects are on the thyroid. So hypothyroidism affects 10 million people in the United States. Besides having annoying symptoms, if it's left untreated, it actually can cause high cholesterol and heart problems. So that could be very serious. Now, since it can be something that's very difficult to self-diagnose, it's best to speak with your physician and make sure that you are diagnosed properly. Now, when I was diagnosed over 10 years ago, the thing that I noticed that improved the most after taking medication was my energy level. It used to be when I had a long day that was going to be busy with no time to rest, I would just dread it because I would be dragging trying to get through the day. But after taking the medication regularly, I had so much more energy. I didn't mind having a long, busy day. I was able to handle that without having to struggle. What kind of experience have you had? I'd like to hear. Put it in the comments if you have had to experience some of these symptoms of hypothyroidism. So the treatment is very simple and it could greatly improve the quality of your life. So if you suspect that you could have this condition, be sure to talk with your doctor. And I hope to see you in the next video where we'll discuss another way we can improve our health.